तो हेलो हाय, अभी हम लोग अल्ट्रासाउंड एंड अप्लाइड एस्पेक्ट्स ऑफ सोनोग्राफी वी विल स्टडी दिस. एंड अल्ट्रासाउंड इज ए नॉन आयोनाइजिंग डायग्नोस्टिक इमेजिंग टेक्निक with a high frequency sound waves and which allow evaluating of various organs without giving any radiation to the patients. So इसमें रेडिएशन कोई भी नहीं होता है. आयोनाइजिंग या नॉन आयोनाइजिंग रेडिएशन होता है एंड इसमें साउंड वेव्स यूज की जाती हैं. एंड अल्ट्रासाउंड क्या है? सो अ ह्यूमन बीइंग कैन हियर द साउंड वेव्स फ्रॉम द 2 हर्ट्ज टू 20 हर्ट्ज टू 20 किलो हर्ट्ज एंड वाइब्रेशंस विथ फ्रीक्वेंसीज हायर देन 20 किलो हर्ट्ज आर टर्म्ड एज अल्ट्रासोनिक. एंड जो हम लोग अल्ट्रासोनिक बीम्स होती हैं यूज की जाती हैं, डायग्नोस्टिक इमेजिंग रेंज जो होती है 2 मेगाहर्ट्ज से 15 मेगाहर्ट्ज तक होती है. एंड 1 मेगाहर्ट्ज में 1000 किलो हर्ट्ज होते हैं. 1 मेगाहर्ट्ज इज इक्वल टू 1000 किलो हर्ट्ज. जो हियरिंग रेंज होती है 20 हर्ट्ज से 20 किलो हर्ट्ज तक होती है. सो अल्ट्रासाउंड मशीन ऐसी दिखती है एंड दिस इज द ultrasound probes. These are the probes, and ultrasound machine look like a desktop computer with various probes attached to it, and these probes are of different frequencies and used for different purposes. And higher the frequency, better is the resolution and poor penetration. जितना ज़्यादा हाई फ्रिक्वेंसी होगी रिजोल्यूशन उतना ही अच्छा होगा, बट पेनिट्रेशन कम होगा इनटू द सॉफ्ट टिश्यू. एंड ए बैलेंस बिटवीन रिजोल्यूशन एंड पेनिट्रेशन इज रिक्वायर्ड. रिजोल्यूशन और पेनिट्रेशन के बीच में बैलेंस रिक्वायर्ड होता है. एंड दीज प्रोब्स आर मेड अप of a specific type of piezoelectric crystals and principle of ultrasound. So ultrasound waves are generated from piezoelectric crystals like zirconate titanate and vibrates when compressed and decompressed by an alternating current applied across the crystal. These high frequency sound waves travel in straight lines. ये जो हाई फ्रीक्वेंसी साउंड वेव्स होती हैं स्ट्रेट लाइन में ट्रैवल करती हैं लाइक इलेक्ट्रोमैग्नेटिक बीम ये जैसे हैं इन द बॉडी. एंड दीज वेव्स आर partially reflected and partially transmitted between different tissues interfaces, and these reflected waves are detected by the same crystal converted into electric impulse, and which are amplified and displayed on TV monitor and can also be photographed. And the remaining transmitted wave goes deeper, again reflected from the tissue interfaces and again read by the crystal. Ultrasound waves are almost completely reflected at interfaces with gas and bone, and thus are poor in imaging gas containing organs and bony structures. Ultrasound is ideal in differentiating solid from cystic structures. And different modes of ultrasound are used in medical imaging. So these are the A mode. A mode is the amplitude modulation, and this is the simplest type of ultrasound. Received energy at a certain time from a certain depth can be displayed as energy amplitude, and the greater the reflection at the interface and the larger the sign amplitude will appear on the A mode screen. इसमें जितना ज़्यादा रिफ्लेक्शन होगा इंटरफेस का उतना ही ज़्यादा सिग्नल एम्पलीट्यूड अपीयर होगा ए मोड स्क्रीन में. एंड दिस इज़ यूज्ड इन ऑक्यूलर आई अल्ट्रासाउंड बाय ऑप्थेल्मोलॉजिस्ट. ये ऑक्यूलर आई अल्ट्रासाउंड में यूज होता है बाय द ऑप्थेल्मोलॉजिस्ट के द्वारा. एंड ए मोड यूएसजी looks like these peaks, and this is the amplitude modulation. And B mode, so B mode is stands for brightness, and the amplitude of returning echoes are displayed as varying shades of gray between black and white. Black is due to weak signal, white signifies high amplitude and strong signals. This is most commonly used mode of ultrasound. ये काफ़ी ज़्यादा यूज़ किया जाता है अल्ट्रासाउंड में. एंड इसमें जो ग्रे बिटवीन ब्लैक एंड वाइट होता है, ब्लैक इज ड्यू टू वीक सिग्नल की वजह से होता है, वाइट सिग्निफाइज हाई एम्पलीट्यूड को, स्ट्रॉन्ग सिग्नल को, इसी को सबसे ज़्यादा यूज़ भी करते हैं। दिस इज़ द बी मोड यूएसजी एंड एम मोड. M mode stands for motion and developed from A mode, and returning echoes are recorded as bright dots along the time base, and this makes abbreviations of moving structures during a specific time intervals. This is extensively used in echocardiography to show movements such as mitral valve. तो हम लोग इकोकार्डियोग्राफी में एम मोड यूज करते हैं, मोशन मोड, जिससे कि उसमें रिटर्निंग इकोस को रिकॉर्ड किया जा सकता है ब्राइट डॉट्स के रूप में, एंड ऑब्जर्वेशन मूविंग स्ट्रक्चर्स को कर सकते हैं ड्यूरिंग ए स्पेसिफिक टाइम इंटरवल में. एंड दिस इज़ द एम मोड अल्ट्रासाउंड. एंड डी मोड और डॉपलर मोड. So this is based on Doppler effect, in which there is a change in frequency or of a signal due to the relative movement of the source of signal and the observer. To detect blood flow within the arteries and vein, continuous wave Doppler can be tell velocity, while the pulsed Doppler give information both about depth and velocity and direction of flow. So this is the Doppler mode and duplex scanning. So Doppler uses generally blue and red color. So where blue is for away from the probe, and जो रेड है वो होता है टुवर्ड्स द प्रोब. And duplex scanning. So this combines real-time scanning with pulsed Doppler. It can study the structure details of vessels along with blood flow pattern. Lately, color Doppler has also been introduced, and the pattern may be red, blue or mixed depending on the direction of the blood flow. ये mixed भी हो सकता है, डिपेंड करता है on the direction of the blood flow पे. So color Doppler is look like this. And this clinical indications of ultrasound. So ultrasonography is now a widely available safe imaging modality. This lessons will familiarize you with the spectrum of its use. So there are competing claims for the superiority of one imaging modality over another, like ultrasonography, CT, MRI, and radionuclide scanning. None of the less, since ultrasonography is non-invasive and non-analyzing, relatively inexpensive and widely readily available, so it should still be used first whenever feasible. So the non-invasive expensive techniques such as CT and MRI should be reserved for those cases in which ultrasound has not been able to provide an answer to the clinician questions. And clinical applications of ultrasound has become major screening modality in suspected diseases of the parenchymal organs of the abdomen, and it is the imaging modality of choice for evaluation of diseases of the gallbladder and biliary tract. And it is also used for the evaluation of infants' brain, eyes, neck, including thyroid glands, and chest, breast, scrotum, and joints. So ultrasonography is one of the principal modalities in evaluation of pelvis, particularly female reproductive system. The urine-filled bladder used to acoustic window allows multiplanar evaluation of the uterus, ovaries, and vagina, and the development of transvaginal ultrasound offers an alternative approach to viewing the pelvis. And sonography does not utilize ionization radiation, is therefore preferred in the pediatric patients and in patients with childbearing age, and when a non-neoplastic mass such as follicular cyst or ectopic pregnancy is thought to be present, USG is the method of choice of imaging for the ovary. And furthermore, with the simplicity and flexibility, ultrasonography has proved to be a major tool for guiding diagnostic, therapeutic, aspiration procedures. And the portability of the small renal real-time units allows useful clinical contributions to made at the patient's bedside in critically ill patients, particularly in the intensive care unit, for guiding procedures even in the operating room. And disadvantages of the ultrasound. So a major disadvantage of sonography is that the quality of images is variable depending on the expertise of the operator and the resolution of equipment and patient's body habitus. And presence of gas in bowel lumen prevents proper evaluation of bowel, and moreover it acts like a strong reflector of sound waves, preventing visualization of structures behind air containing bowel like retroperitoneal nodes and pancreas. So bony structures cannot be evaluated with sonography. So most of referring clinicians are uncomfortable with ultrasound images and find them difficult to interpret, correlate. And pre-examination details and patient preparation. So a complete history taking of the patient is more mandatory, since goal oriented but examination is more likely to be diagnostic than on that is not goal oriented. So abdominal sonography is ideally performed after the patient has been overnight fasting to minimize bowel gas. Overnight fasting is necessary if good examination of gallbladder is required. These patients are kept fasting 8 to 12 hours to ensure gallbladder distension and reduce the amount of gastric and intestinal gas. And if there is inadequate visualization of pancreas and stomach may be distended with water given orally to act as an acoustic window. So for pelvis evaluation, distended bladder is essential, as urine filled bladder is used as an acoustic window in patients with a urinary catheter. Evaluation of the pelvis requires the clamping of the catheter to distend bladder, and bladder is emptied prior the endovaginal sonography. So for a successful pediatric sonography, it is important to evaluate children, obtain their cooperation. For the infants may be breastfed or older children may be distracted with toys. Some may be need to seated important monitor vitals of a child who is sedated. To evaluate the infant's bladder or pelvis, the child may have to be repeatedly taken for USG examination every 15 to 20 minutes to see whether his bladder is in full, because child may void spontaneously as soon as his bladder in full. So scanning techniques. So patient is placed in the supine position on the examination table. Mineral oil or gel, preferably warm, is used as an acoustic coupling agent, applied to the skin over the entire upper abdomen, and an appropriate transducer is selected for the size of patient and area to be examined. Usually there is a 3.5 to megahertz curved linear array transducer for abdomen is used. 3.5 मेगाहर्ट्ज का कर्व्ड जो लीनियर एरे ट्रांसड्यूसर है वो यूज किया जाता है, and this generally provides optimum resolution while maintaining adequate depth penetration. And a 5 megahertz curved 7.5 megahertz linear array transducer provides greater resolution for children and thin individuals. जो 5 से 7.5 मेगाहर्ट्ज का लीनियर एरे ट्रांसड्यूसर होता है, वो प्रोवाइड करता है ग्रेटर रेजोल्यूशन फॉर द चिल्ड्रंस एंड थिन इंडिविजुअल्स के लिए, and a more tightly curved linear array transducer can be used to scan a small window such as intercostal and subcostal spaces. 7.5 megahertz transducer is suitable for the small parts like brain, eye, thyroid, breast, scrotum, and joints. So, to maximize the diagnostic sensitivity and minimize the scanning time effort required, we use a through standard sequential organ-oriented scanning technique, and emphasis on certain structures and areas depends on the history given on the pathology found. After all organs and their continuous structures are individually and thoroughly examined, diagnostic compression is formulated. And no pathology is seen. A limited number of standard hard copy images are recorded, and these generally contain sufficient anatomic landmarks to allow easy identification of the organ and projections, and all definite suspicious lesions should be frozen and photographed in multiple projections to show not only the lesion but also the relationship between surrounding identifiable structures. So, Doppler study is done to derive following information: if there is moving blood present, to detect presence of thrombus or occlusion, which way it is going, direction of flow, how fast it is moving, fast speed of flow, and character of flow, luminar or turbulent, etc. So power Doppler is variant of Doppler in which there is only information about the presence or absence of flow, but without any information without direction of flow. However, power Doppler is more sensitive than Doppler sound ultrasound to detect the presence of or absence of flow. So, applications of Doppler: carotid Doppler for evaluation of stenosis and for evaluation of carotid plaque, and peripheral Doppler evaluating extremities, arterial system for evaluation of stenosis and for evaluation of atherosclerotic plaque, and for venous system for evaluating varicose vein, and for the evaluation of deep venous thrombosis, and abdominal Doppler for the renal Doppler for evaluation of renal artery stenosis and evaluation of renal vein thrombosis, and Doppler ultrasound of portal venous system, so for evaluation of portal hypertension, and OPS Doppler for evaluation of blood flow in uterine and umbilical arteries. So these are the some questions arised from this chapter. And now CT scan and its applied aspects. So CT scan refers to radiographic examination of patient displayed as a cross-sectional grayscale tomographic images, a computer-assisted mathematical reconstruction of numerous X-ray absorption differences of various organs tissues helps to build up the images. So the person credited the first successful clinical demonstration of CT was Sir Godfrey Hounsfield, and research scientist at EMI Research Laboratories in England, who in 1972 produced the first cranial scan using X-rays with a computer reconstructed images displays on a television monitor. जिन्होंने 1972 में पहला जो क्रेनियल स्कैन किया था यूज करके एक्सरेज को विद ए कंप्यूटर रिकंस्ट्रक्टेड इमेजेस डिस्प्लेड ऑन ए टेलीविजन मॉनिटर पे, एंड जो सिटी स्कैनर्स होते हैं हैव नाउ a long way of advancement in technology related to software and hardware in computer science. So, CT scanners are now available to the ordinary man at a reasonable cost. With evaluation in technology, present day CT scanners are able to minimize patient examination time and radiation exposure. Faster scanners are now available even for CT imaging of hearts. So, general principle of CT का क्या है? So, principle of CT is similar to the conventional tomography, in which there is a slice of tissues which comes into focus and slices above below are blurred out and not in focus. So, tomogram is obtained by making X-ray tube and images detectors move about a focal point during the exposures. So, primary difference between conventional and computed tomography is that in conventional tomography, the images is recorded on a conventional X-ray film and CT components are used to reconstruct the focused images and tomographic slice as received by the image detectors. And the principle of computed tomography is that the internal structure of any three-dimensional subject can be reconstructed from the many different projections or views of that subject. This necessitates the collection of large amount of data in order to reconstruct the accurate picture of original structure. So, advantages over conventional radiography. So, CT has three distinct advantages over conventional radiography. First, dimensional information is displayed which is not available in conventional tomography, and the second system is much more sensitive when compared to conventional radiography, so that differences in soft tissue can be clearly delineated. And CT measures X-ray absorption in individual tissues accurately, allowing the basic nature of tissue to be studied, and this is possible by displaying or reading of CT Hounsfield numbers or Hounsfield units of various tissues. So, lung air has -1000 Hounsfield units and or less, and fluid such as CSF has 18 to 20 Hounsfield units. Calcification has 500 Hounsfield units, and gray and white matter brain has 30 to 40 Hounsfield unit, and fresh blood is 50 Hounsfield units, so on. So, disadvantages of CT. So, CT can deliver relatively high dose of radiation, and sometimes patients may develop allergic reaction of contrast media. Usually it is mild, but sometimes it may severe and even may take the life of patient, and it is costly investigation and not readily available in towns and small hospitals. And generations of CT systems. So, since the introduction of clinical CT scanning in 1972, equipment systems have evolved through stages commonly referred to as generations. Each generation of scanners decreased the scanning time and time required gather information for each scan. Difference between succeeding generations scanning system primarily involved X-ray tube and detector arrangements. The addition of more detectors reduced the scanning times considerably. So, first generation scanners for the original CT scan unit was first generation scanners, and it had a pencil like X-ray beam single detector. जो फर्स्ट जनरेशन CT स्कैनर्स की थी वो पेंसिल लाइक बीम यूज करती थी एंड ए सिंगल डिटेक्टर. सो एक्सरे ट्यूब डिटेक्टर मूवमेंट्स वर बोथ लीनियर एंड रोटेटरी. सो ट्रांसलेट रोटेट टाइप था फर्स्ट जनरेशन में, एंड वन टोमोग्राफिक सेक्शन ऑफ हेड यूज टू टेक 5 मिनट. जो वन टोमोग्राफिक सेक्शन हेड का लेने के लिए 5 मिनट लगते थे. सो ट्रांसलेट and then rotate then translate. So first generation rotate translate compound tomography, and ये इसमें सिंगल डिटेक्टर्स और ट्रांसलेट रोटेट जियोमेट्री. रोटेटर मूवमेंट was 1 at the end of each linear scan. So total rotation 180 semicircle and pencil beam of X-ray, and scan time 5 minutes approximately. And second generation scanners. So to shorten the scanning time for each tomographic section, pencil beam and single detector were replaced by fan beam and multiple detectors. In second generation scanner, number of detectors vary, may be up to 30 or more. The movement of X-ray tube detector array are both linear and rotatory. In second generation scanner, time taken per tomographic section was 30 seconds. So this was the second generation, and this has two detectors, and this was the fan shaped and little fan beam, and number of detectors vary, maybe up to 30 or more. And X-ray detector linear and rotatory. And second generation scanner, time taken per tomographic section was 30 seconds. एंड इसमें क्या था, मल्टीपल डिटेक्टर्स यूज्ड थे, एज मैनी एज 30. ट्रांसलेट रोटेट टाइप था, रोटेटरी स्टेप्स आर लार्जर अप टू 300. स्मॉल फैन बीम था 3 to 100, एंड स्कैन टाइम 30 सेकेंड्स पर स्लाइस था. उसमें 5 मिनट्स पर स्लाइस था, एंड इसमें 30 सेकेंड्स पर स्लाइस. एंड थर्ड जनरेशन स्कैनर, in the third generation scanner, translation movement was completely eliminated. In this, both X-ray tube and detectors array rotates around the patient's. Multiple detectors, 700 in numbers, and are arranged along the arc of circle opposite the X-ray tube, which together rotate around the patient in a complete 360-degree cycle to create one tomographic slide. Patient and table are then moved on increment superiorly and inferiorly. The tube and detector rotate full 360-degree cycle in opposite direction and create second slice of tissue data and so on. Time taken is one slice के लिए 1 to 3 seconds approximately. And this is the third generation. And CT scan, this is multiple detectors were used, rotate type, and large fan beam यूज होता है 50 to 55 डिग्री, एंड स्कैन टाइम है 1 to 3 seconds फॉर पर स्लाइस. एंड fourth generation scanner, and fourth generation scanner developed during 1980s possess a fixed ring as many as 4800 detectors. 4800 detectors compare completely surrounding the patients in a full circle within a gantry. A single X-ray tube rotates through a 360 R during data collection. 360-degree circular array of fixed detector rotates fixed type, and large fan beam 50 to 55 degree, and scan time 1 to 3 seconds per slice. This is the fourth जनरेशन, एंड इसमें जो यूज हुआ है रोटेट एंड स्टेशनरी, रोटेट एंड स्टेशनरी टाइप यूज हुआ है. सो बट बोथ थर्ड एंड फोर्थ जो है, थर्ड में रोटेट है, एंड फोर्थ में रोटेट एंड फिक्स्ड स्टेशनरी भी कहते हैं इसको. सिटी यूनिट्स गिव्स एक्सीलेंट रिजल्ट्स विथ नो क्लियर एडवांटेज ऑफ नो one over the other. And helical CT scanners. So during the early 1990s, a new type of scanner was developed known as helical CT scanner. So in this system, the patient continuously moves slowly or in out during 360-degree circling X-ray tube, creating helical or coiled spring type of data acquisition. In this where a volume of tissue is examined and data collected rather than individual slices as with other systems के साथ. So helical CT systems utilize जो helical CT system है utilize करता है either third और fourth generation type detector arrangements, with most helical system utilizing the third generation type यूटिलाइज करता है थर्ड जनरेशन टाइप को. एंड फॉर्मरली एक्सरे ट्यूब with attached high tension cables was limited to one 360-degree rotation in one direction, comprising one slice followed by another 360-degree rotation in opposite direction, creating a second slice. The patient moved one increment between slices. So this is the helical CT. So imaging volume and gantry X-ray tubes. So the development of the slip ring engineering technology allows for continuing tube rotations when combined with patient movement creates a helical type of scan data, and total scan time for that are one half or less than that of other third or fourth generation type scanner. So components of CT tomographic system: scan unit and operator console. So all CT systems consist of two major elements: scan unit and operator console. So scan unit provides information about the computer. Scan unit is in-housed in separate room, scanner room, and it is the part of system seen by the patient. And scan unit in the scanner room consists of two parts: patient table and gantry. So patient table or couch provides the comfortable surface for the patient in lying down, recumbent, and position and scanning time. So gantry is a rigid support structure that houses the X-ray tube and the radiation detector array, and the patient table moves in and out within the central opening of the gantry, which is called the gantry aperture. So this is the CT equipment, gantry, patient table, and operator console. So a second major element of any computed tomographic system is the operator controls console. So which includes the processing unit or computer that takes raw data and converts it into a पिक्चर फॉर्म, और इसको कन्वर्ट करता है एक पिक्चर फॉर्म में. एंड ऑल द नेसेसरी कंट्रोल to process through each examinations are located at operator control console, which is located just outside the scanning room and includes controls for exposure factors, KVP, MA, scan time, as well as slice thickness and pitch selections, scan direction, and other variables that may be specific to the equipment being used. Image manipulations such as edge enhancement, zoom, brightness, contrast control are also possible to the control console. And most modern control consoles include two color monitors, one for the control displays and one for viewing the radiographic images. So image recordings and storage can be done by two methods. So most modern systems use laser printers, printout of the films for permanent storage of data. Information in digital form, CD and DVD can be used, and this information can be readily retired at any time. So clinical indications of the CT scans. So indication usually after primary investigation as X-ray and USG patient is preferred for the CT scan for better characterization and detection of disease depending upon various part indications may be as. So head के लिए virtually as any suspected disease process involving brain. Indication for cranial computed tomography. Some common indication cranial computed tomography may include brain neoplasm, mass brain metastasis, intracranial hemorrhage, aneurysm, abscess, brain atrophy, post-traumatic abnormalities such as epidural or subdural hematomas, and acquired or congenital abnormalities. So this is the brain CT, NCCT of the head and thorax. So this is the thorax, lung window and mediastinal window. So most lung and mediastinal abnormalities of chest as documented on plain radiographs are indication of CT. Some of the more common indications for CT of the chest are non-resolving lung, pleural diseases, mediastinal and hilar lymphadenopathy, and aortic aneurysm, cardiac and pericardial diseases, and abdomen and pelvis. So abdomen, some of more common indication for CT abdomen include suspected primary metastatic lesions of the liver, pancreas, kidney and spleen. CT tomography is preferred choice of examination of suspected adrenal gland pathology and pelvis. In the region of the pelvis, computed tomography is primarily used to provide information on the state of advancement of pelvic disease. So, computed tomography has proven valuable for the evaluation of prostatic, cervix, urinary bladder, ovarian, carcinomas, and other indications, or evaluation of soft tissues, masses, diseases of pelvic muscles, suspected abscesses, and evaluation of hip joint, especially in trauma patients, and whole body CT in trauma in the most common indication of the whole body CT, as it is very fast and give complete information from soft tissue to bone, from head to toe. So contraindication of the CT, there is no major contraindication of CT except pregnancy and history of allergy to the contrast media. In a patient, drug allergic advisable to carry out procedure in a supervision of anesthetist and do only plain CT and CCT. एंड कंट्रास्ट मीडिया जो कि यूज होते हैं सिटी में, used for the excretory urography. These iodinated contrast media are administered as intravenous injection. First CT scanning is done without contrast, then after IV injection of the contrast media, scanning is repeated. The use of contrast media can valuable information about and useful in separation of soft tissue lesion from lymph nodes and vascular structure. The enhancement of pattern various lesions also helps in characterize them. Intravenous contrast is also important for visualization of ureter and bladder. We can tailor study according to the indication or patient. Like in child, we avoid plain scan to reduce radiation dose, or in some cases we can take more than 2 scan. पेशेंट प्रिपरेशन क्या ज़रूरत होती है? एम्प्टी स्टमक टू प्रिवेंट should be empty stomach to prevent complication of vomiting after IV contrast media. All metallic objects should be removed in the radiographic area interest, because metal will produce artifact. It is better to change the clothing of patient to prevent unwanted artifacts from buttons, coins and pockets or keys. And patient motion during procedure impairs quality of the CT. So patients should be given breath holding instruction. Thorax and abdomen informed required for the CT examination. And for abdominal CT, large bowels should be free from fecal matter as far as possible prior to the examination. Patients should be taken a laxative in the evening prior the CT scan examination, and use of oral and rectal contrast media opacify GIT it's necessary abdomen and pelvis. Non-opacified portions of small and large intestine can be misdiagnosed as lymph nodes and abscess and mass, and water soluble iodinated contrast media are used to pacify bowel in most department, which is ingested orally, inserted per rectally in diluted form, and contrast scale for viewing. After scanning the patient, images can be seen in different scale, also known as window in different planes, and soft tissue window in used to see abdomen, brain, and mediastinum, and bone window is used to see bones. A lung window is used to see lung parenchyma, and multiplanar reconstruction. By this technique, axial images can be constructed in sagittal and coronal planes. So these are the questions arises from this topic. And now MRI and its applied aspects.